Hi, everyone, and welcome to the latest CCAG climate conversation. I'm Dr. Ciara Judge, and I'll be your host for today. I'm a pandemic sciences research fellow at Oxford University with a particular interest in the interaction between climate and infectious disease. Climate change is often discussed in the abstract in terms of emissions and targets and temperatures and what exactly that means for the physical geography of the planet. But the thing about this beautiful blue rock is that all of us humans live here too. So increasingly, these impacts of climate change are being felt in daily life through heat, air quality, food security, and the spread of disease. So with that in mind, in this conversation, we're going to explore what happens when climate change is understood not just as an environmental issue, but as a public health challenge, and how that might reshape national climate strategies. I'm joined today by two fantastic guests, and we're going to unpack this together. We have Professor Mark Maslin, member of CCAG and Professor of Earth System Science at UCL University College London, and Mr. Climate, that is Olumide Idowu, co-founder of the International Climate Change Development Initiative and the Nigerian Youth Climate Coalition. Thank you guys both so much for being here. I'm excited. I think it's going to be a very interesting conversation.
Thank you for having me.
So as I said in the opening, climate change can often sometimes feel quite abstract, both spatially and temporally. So if you are lucky enough to live in a place where you're maybe not getting adverse weather effects, you're not getting hurricanes, you can say, well, it's not happening here. And quite often the horizons on which we discuss the impacts of climate change are so far into the future or increasingly less far into the future, but it's still very easy to say that it's not happening now. But the truth is that the effects of climate change are very real and very tangible and being felt globally and all over the world right now, every single day, particularly showing up in the way that it's affecting people's health. So for this, I want to throw to you, Mark, and I just want to ask, what are the impacts of climate and how are they already showing up in people's everyday health?
So firstly, we need to understand how our health is formed, because it's shaped by the health of our parents, it's the air that we breathe, it's the work we do, and it's also the food we can afford, the strength of our communities. So for millions of people, these conditions are defined by poverty, inequality, and pollution. We then add climate change to that, and climate change compounds these issues in many unfair and unpredictable ways. In the poorer the country or the nation or the community, the greater the risk of exposure to things like extreme weather, food and water insecurity, disease, forced displacement. And we have to say that these are the people that have contributed least to global heating. So we have a major health problem at the moment with billions of people that don't have access to fresh, clean drinking water, billions of people that don't have food security or access to sanitation. And then on top of that, we're compounding that by changing the climate and changing their exposure to extreme weather, air pollution, and other risks.
Yeah, exactly. And I think something that really resonated for me that you kind of brought up there is how as with nearly every impact of climate change, the people that are really feeling the brunt of this are actually those that have kind of contributed the least to the problem. And I think that some of this is due to the systemic nature with how climate is influencing people's health. So as you were saying, it's making healthcare systems less resilient. It's contributing to food insecurity, which is reducing health overall. It's affecting people's air quality and mental well-being. And Olumide, I just wanted to ask for your kind of opinion on that. Why is it that, as always, some communities are more exposed than others, and quite often it's those that are contributing the least to the problem?
Yeah, thank you very much. We all know that climate change is actually affecting human health. And in many ways, the issue of rising temperature, extreme weather, even environmental degradation that has become more frequent in our society. And this cut waves and
is increasing a lot of stress. So the impacts are really felt on community and is already showing up in our daily lives and even the health system around the world, most especially people that are receiving air. There's a statement that says, when two elephants are fighting, it's the grass that suffer. So the issue of poor air quality that is already linked to climate change has also contributed to this fact that the heat disease and even other lung-related illness is affecting people at the community level. Like Prof said, food, water shortage have caused a lot of drought. And when you see this kind of people that are coming from those communities, these are the people that are really eat hard. And the issue of the rainfall pattern has also led to a lot of malnutrition and even weakened immune system of these people. So I can say that vulnerable groups are such of people like the children, the elderly ones, and even the low-income community are often the most affected. And it is making climate change not only an environmental issue, but also a major public health challenge that we are facing presently in our society. Thank you.
I think, like, listening to both of you, what really occurs to me is like the pervasive nature that by which climate is able to impact people's health on all different levels, which definitely I think stands out as a huge problem, and I'm glad that we've kind of able to point to that as the framing for this conversation. But I wonder if there's a school of thought where this kind of symbiotic, very interconnected relationship between climate and health also provides something of an opportunity. I think like there's multiple lenses through which to look at this, but first of all, through the communication lens, I think from both of your experience as science communicators or climate activists, getting the general public behind climate action is one of the most important aspects of this work, and quite often the way that it impacts our health is quite an accessible entry point for the general public. Like I was saying earlier about how it can often feel quite abstract, but when it starts affecting your daily well-being, it becomes a lot more tangible for people. So actually, Olumide, I'd like to start with you from the idea of kind of for the general public. How does looking at climate change through this health lens maybe shift the way that people would engage with it and the way that we can kind of communicate the problem?
Yeah, well, looking at the issue of communicating climate change, you'll be able to understand that we need to actually, first of all, understand what are the key communication opportunities around this conversation of climate change and health. And when you see the issue of air pollution to human health outcomes, are one of the ways whereby we need to communicate clearly how poor air quality contributes to diseases such as asthma or such as heat disease. And if you look at the issue of promoting climate solution as health solution, it's also some way of highlighting how transitioning to a sustainable way or reducing our fossil fuel use improve. So it's something that we need to start looking at in a way whereby we need to communicate in a proper channel. But let me end by saying that the issue of using data or real time, is something that is also a way of getting the actual problem, so that we'll be able to push out or raise public awareness and encourage behavioral change and policy support in this aspect of conversation. So it's time for us to start looking at how to amplify communities and youth voices, or how to engage community or vulnerable population in the issue of advocacy or highlighting the local impact of climate change or the health. How is it making it an issue more than relatable or an urgent problem for the society? Thank you.
For sure. I think, like, personally as a scientist as well, I really resonate with your idea of kind of we need the data and we need to be able to communicate it. And also that makes me think of you, Mark, because of your experience in, well, obviously as a professor of earth system science, but also just due to your background in science communication. So I kind of have the same question for you. about how I think, first of all, it's a two-pronged question. So first of all, for the general public, what is there to be gained, I guess, by trying this health lens, shift towards the health lens for communication of climate science? But then also, I think I'm quite interested in your experience because you work a lot with policymakers. Do you need a different approach there? Is it the same approach? How does that differ between communicating to the general public versus trying to influence policy?
I love the fact that you've just given me two huge questions. So don't worry. And if I actually had the real answers, of course, we will be communicating much better. I think the first thing is to think about the public. We all care about our health. We care about the health of our families. We care about our children. And if you have children, we worry about their health constantly. You know, are they eating healthily? Are they breathing healthily? And so therefore, that means it's a really emotive subject. So being able to engage people to say, look, if we do these policies, it's going to improve your health and your children's health. And I'm going to pick up on something. We've been talking about air pollution. The studies that are coming out show that between 8 and 10 million people die prematurely per year of fossil fuel caused air pollution. Just think about that. So if you got rid of fossil fuel burning, you would save 10 million lives per year. You know, that's a huge change. And so therefore, we need to actually communicate these. And sometimes it's really like being that frog where that's been in cold water, we've heated it up. It's like we haven't noticed the pollution around us. We haven't noticed all of the dirt. We haven't noticed all the impacts on health because it's been slowly accumulating as we develop. It's now time that our scientists turn around and go, this is what's killing you. So I think that's really important. When we move to the policymakers, what's really important is most countries, one of the biggest financial outlays there of any government is health. Okay, in many developed countries, you're talking anywhere between 10 to 18% of their GDP is just on their health service and trying to keep their populations healthy. So it's a big outlay. So if you can then turn around to policymakers and say, look, if you do this policy over here and you switch away from fossil fuels to renewable energy, yes, you're going to have energy security. It's going to be cheaper. But by the way, the co-benefits over here is you're going to save so much money from your health services. And I think that's the important. It's then showing to policymakers that their enlightened policies save money across the whole of the different parts of government. And so when we've approached policymakers with climate change and health as a lens, we talk to not just the Ministry of Environment, but we talk to the Finance Ministry, which controls everything. But we also can talk to the Health Ministry, the Transport Ministry, because it's that joined up thinking that allows win-win-win throughout government. And of course, politicians like those wins because, of course, if you're seen to be helping your population be more healthy and have better livelihoods, tick, 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 you might going to stay into power and you might get elected again.
Yeah, 100%. I think sometimes it's the elephant in the room, I think, that we're afraid to just be realistic about the motivations of some of the policymakers that we're trying to influence, in that, you know, climate change is addressing the climate crisis is significantly important for the long-term health of the world. But these politicians also have their mandate. They have, you know, the next election cycle to think of. And I think being able to communicate to them the multifaceted benefits of climate action that can be felt in the here and now can be a motivator. And I think it's something that I guess is definitely a useful communications tool. I think like my own personal anecdote about it is, you know, my own interest is in this idea of climate sensitive disease. And as was mentioned, I think earlier, it's one of the very many influences that climate is having on our health worldwide is expanding the niche for these diseases, such as like dengue to come to France. The mosquitoes that are able to transmit West Nile virus are now present in the UK and gaining a foothold in the UK. And while, we would love for politicians to act on climate change out of, the goodness of their heart, we also have to understand that, they need to look out for people's health in the here and now. But the truth is that, these two things don't have to be separate, right? You can work on these problems together. And I think that's something that's really important and interestingly communicated in what I'm about to come to, which is the recent CCAG report on climate and health. So, Mark, I'm coming right back to you after asking you two very big questions. I'm so sorry. But in this report, basically, you guys identified 4 key areas of opportunities that you called win-wins for climate and health. To me, I think this is the most exciting part because it basically provides us a roadmap for measures that will improve our health while also addressing the climate crisis. So, Mark, I would like it if you could maybe talk us through those 4 win-wins and what they mean in practice, how maybe we can act upon them, and what the implications might be.
Well, I think the report is really timely and very insightful because what it does is take major health issues and climate change issues and puts them together. And the whole idea is if you tackle both of them, then you can lift millions of people out of extreme poverty. I mean, the first one we've already talked about, which is transitioning away from fossil fuels. And I love this term, electrify everything. The reason being is that brings huge benefits for switching away from toxic air. It allows people to be able to have less polluted, quieter and cleaner cities. But it also then means that the air pollution and the heat domes you find in cities are reduced. So again, it's a win-win. The next one is stewarding our natural environment. If we can green our cities, if we can use nature as a way of helping us adapt to climate change, but also to mitigate against climate change, that's going to be incredibly important. I mean, remember, the urban heat island in some of our huge megacities, there can be a 10 degrees hotter climate in the city than in the countryside surrounding the city, which is ridiculous if you think about the number of heat waves we're having in the future. The third one is transitioning our food systems. There are 2.3 billion people that go to bed feeling hungry at least a couple of months per year. This is ridiculous when we actually do produce enough food for about 10 billion people. There's only 8.2 billion. So there's a lot of wastage. There's a lot of problems there. So if we can start to work out how we move to more efficient and, of course, less emitting food systems, that helps. Now, of course, that's going to mean moving away from a meat-based diet. Now, the way I sell it and the way the report talks about it is it's reducing your meat consumption. Brings lots of health benefits, reduces obesity in the developed world, but it also then makes sure that we are reducing the undernutrition that occurs in many poorer countries. And the last one, which I think is probably the most important, is building resilient infrastructure. Now, that sounds a very grand term, but 2 billion people don't have access to safe drinking water. 1.5 billion don't have access to safe sanitation. And by 2050, it's predicted that if we don't deal with climate change, 5 billion people will be facing water shortages. This is ridiculous, okay, in a world of the blue planet where we have water. We need to stop mismanaging it. So again, a really good health outcome is if we work out how to actually protect our water sources, make sure we manage them properly, make sure that everybody has access to safe water. That reduces exposure to waterborne and respiratory diseases. And of course, that infrastructure is then able to strengthen our schools and hospitals and make sure that our cities are a lot more resilient and cooler as climate changes. So I think it's trying to change the policies makers' mindset to say, focus on people's health, focus on these 4 major topics and see how just by tweaking things, And the weird thing is, in the short term, it saves money. Renewable energy is much cheaper than fossil fuels. As we've seen with the geopolitics at the moment, you really don't want your country beholden to the markets. Fossil fuels have literally just jumped up by 30% in cost, whereas, trust me, your wind and your solar and your hydro, exactly the same price. You also want to think about how do you develop your country with the infrastructure and your food to make sure that your population, particularly the most vulnerable people in every country, still have access to water, to adequate food, and to shelter, and then make sure they have access to education, schools, and professional healthcare. Does that help?
Yeah, it does. It very much does help. It sounds very, I think, like large scale, maybe like overarching. I think if you hear those four, like I'll summarize them as transitioning away from fossil fuels, stewarding the natural environment, transforming food systems, and building resilient infrastructure. They might sound to an ordinary person as something that we're going to have to rely on our governments and our policymakers to implement. But Olumide, I would love to throw to you because I think you would agree that we've seen that some of the most impactful climate action comes from the grassroots level. And you have such a rich experience as a young climate activist, but also just working on grassroots initiatives. So I'm wondering, from hearing those four priorities, is there any particular entry point that you would see for young people or the general public to get involved and start creating and building solutions that work towards some of these win-wins?
Yeah, thank you very much. And I want to quickly say thank you to Prof for that, elaborative pathway that you just mentioned. I will say that a lot of grassroots initiatives have shaped the narrative of how things are evolving and changing. And that is why, climate change is already affecting a lot of people's health in many parts of the world. And the more we start raising voices and the more we start increasing, our awareness level, then we start saying that there's a need for 1, 2, 3, 4, 5 people to start keeping the momentum going. And that is why addressing the climate change also presents one of the greatest opportunities to improve global health. And this set of action that can actually turn investment to opportunities, where we are transiting from clean energy to promoting sustainable transportation, protecting ecosystem, and even reducing the population that really reducing a disease burden, and even prevent millions of premature deaths. So I would say that grassroots initiative is one thing that is going to complement the efforts, or so-called, that the government is trying to put in place for the benefit of the people and the environment. And for us to start looking at how do we actually strengthen the climate resilience health system, and how do we integrate health consideration into its policy that will help the community to better prepare for climate impact, while improving overall well-being. This is the role of the people. This is the role of community people. That's saying how actually know that climate action is real, and it's not only an environmental necessity, but it's also a powerful pathway to actually safeguard human health, creating healthy and even more resilient society, not only in Africa, but across the world, in everywhere we are facing this issue. So initiative that turns to investment opportunity in the grassroots level is very, very key and important. And I will end by saying that you remember, food we eat, the clothes we wear, and the shelter on us is one of the key drivers of this conversation that we are having. Because if all these three things can worked on, then you will see that the benefit of the people that are the receiving end will actually, be able to show that we are trying to solve climate crisis, and we are putting a lot of investment in making sure that grassroots initiatives are changing narrative of the kind of resilient society that we want to see. Thank you.
I have to say that your work and all the actual grassroots people around the world, it's absolutely essential, because it's that real people power that local government and government actually listens to. Again, I say this in the nicest way. They don't listen to scientists like me or Clara, you know, sort of like we're far, far away. But people who are actually in the town or in the city who say, look, I'm really sorry, this is killing us. This is causing problems. These are ways to actually change it. That grassroots action is so essential, and your work is absolutely brilliant. So I think people need to know that because they see too much of us sort of like, I would say, white Western scientists saying, no, you must do this. No, it's when real people get real that it makes a difference.
Thank you, Prof.
Yeah, I 100% agree with both of you, and I think it's nice to see how aligned everyone is on the fact that it needs to be all aspects of society. We don't just leave it up to decision makers and policymakers. We empower grassroots activists, grassroots projects that can make a difference towards these 4 win-wins, but potentially the climate crisis at large. But something I want to pick up on that you said, Olumide, you said it can enhance and support grassroots activism can enhance and support the action of policy, right? In that, you know, it can't just be left up to the ordinary people, right? We need institutional change. We need change at a national and international level. And with that in mind, I think I want to turn to kind of maybe our last subject of discussion today, and to you, Mark. In the CCAG report, one of kind of the routes through which we can start to push governments and implement these 4 win-wins, or just implement in general any sort of climate and health action, are the NDCs, or nationally determined contributions. So for our newer listeners, maybe if you want to give a really brief introduction to what the NDCs are, and then I would love to hear from you, I guess, like the latest round of NDCs just kind of wrapped up around last year, around COP30. There was plenty of health mentions in there, but I would love to hear, you know, do you think it was enough? And if not, you know, looking towards the next cycle of NDCs, how do you think these win-wins, this climate and health action that you guys have identified, can be best implemented into these policy documents?
So the NDCs came out of the Paris Climate Agreement over 10 years ago. And these were ways that countries would pledge what they were doing to cut their national emissions of greenhouse gases. But they've actually developed much more into an economic scope document that includes lots of parts of countries' economy and how they're going to transition to net zero emissions. What's interesting is that many countries are using these as a way to understand all of the win-wins and all the different aspects of the fossil fuel transition. And so, again, health has been included in many of those. Again, we have slowly pushed health into the climate agenda. The World Health Organization, the Lancet Countdown that's run out of UCL, have done a lot of work to make sure that policymakers see the connection. So this is really important. So what we need to do is engage with policymakers from countries, from all the departments. So again, it's not just the environment, it is finance, it is transport, it is health, and get them to understand that the NDCs are a very good way of actually building joined up policies within a country. I'm also going to say, I think there's also another opportunity which is in the report, but again, hopefully will be another report in a few years' time, which is we also have the Sustainable Development Goals, which have been developed and will come to an end in 2030. Now, this is another way that you can start to look at countries hitting certain targets when it looks at extreme poverty and how to actually improve people's health and well-being. So that's another vehicle we can use to put in very clear health and climate policies together. So for me, I think it's really important that we engage with policymakers so they understand what people are actually feeling in the grassroots, actually in towns and cities around the world, and be able to see how some of these top level decisions about moving to renewable energy or building sanitation all feed into the public well-being of a country.
Yeah, absolutely. And I think like my takeaway from both listening to your answer here and just listening to what Olumide just said is that just as I guess like climate is impacting and influencing health in this kind of permeating, affecting every facet way, I think that's also the approach that we need to now take to solve this problem in terms of a very cross-sectional, from the grassroots level right up to using these policy vehicles to try and implement change at all scales. Unfortunately, we're kind of out of time. I feel like we could probably talk about this for the rest of the day. But thank you guys both so much for joining. I hope that you felt as good about this conversation as I did, and I hope that everyone that's listening and watching enjoyed this discussion and maybe feels a bit empowered to, first of all, check out that CCAG report, and second of all, start looking for how you can action those win-wins in your everyday life. So if you have enjoyed this discussion, to all our viewers, please do like and subscribe for more climate conversations from CCAG. Thank you to Mark and Olumide, and thank you to all of you guys for tuning in.
Thank you.
Pleasure.